Whoa! Sledgehammer spins, swinging swords, and what kind of wrestling move is that? Today, we're breaking down and reacting to all of the intense medical scenes and all-consuming injuries from the highly popular Battle Royale video game Call of Duty Warzone 2.0. Let's dive right in. Oh, what the? Massive weight to the back of somebody's head. Even though there's a helmet on, you can still cause a significant amount of trauma to somebody's head.
Severe trauma to the head
could cause skull fractures, brain matter being smashed. Without even having a fracture, you can cause some bleeding within the brain. The most common are subdurals and epidural hematomas, as well as interparenchymal bleeding and subarachnoid bleeding. Whoa! Looks like there's a knife that goes into the right side of the neck. If you're doing a slicing motion, then you can just slice the blood vessels in one plane and you're hitting either the jugular vein or the carotid artery. If this goes more in a downward angle in, not only are you concerned with a vascular injury, but you're also concerned about getting into the thoracic cavity. Wow, wow. The strength to be able to pick somebody up like that, one, that's impressive. And then being able to bend somebody over their knee. You're cracking their back. Do you sever the spinal cord? Do you cause vertebral fractures? Is there enough of a fulcrum and enough force going down that actually causes it to snap? So the question ends up being then, do you fracture the bones, or are you just rupturing all the connective tissue that is around that area? I mean, I've seen these moves in MMA fighting, but nothing that's lethal. But in this situation, it was seemingly used to cause a cervical spine injury. They're depicting that it had killed somebody. So to be able to do that, you have to sever basically your brainstem. Wow. Puncture wound, laceration to the neck. Always worry about zone 2 of the neck. There's 3 zones of your neck when it comes to areas that we think about for trauma. Zone 2 has the most critical structures in there. If there's any open tissue, puncture wounds, it typically needs to be explored in the operating room. Wow. Shooting somebody in the kneecap, a lot of pain. The kneecap covers over the area. It's your patella. That can be fractured into multiple pieces. And if that is not intact, you won't be able to extend your leg at all from the knee. And then the other component is, are you going to get shot in the distal femur or the proximal tibia, which then, again, you won't be able to stand because there's no basically support structure. Holy cow. Holy cow! Injury to the right flank of your 12 ribs that go all the way down pretty low. It's protecting your liver on that right side. And so is it actually hitting liver, you're fracturing the ribs, or is it just getting into the flank where basically your intestines? Yeah. If you get stabbed in the abdomen and it rips open, could you die from it? Yes. Does it happen that fast? No. Does it incapacitate you? Yeah, it does because of the amount of pain that you're in. You'd slice through some blood vessels, not major ones, the OMENTUM, which is the fat covering your organs in the abdomen, so you might bleed or have fecal material into the abdominal cavity, but they all take time. Just a lot of blunt trauma to the face. I see a lot of people that come into the ER who've had a lot of trauma to the face due to somebody's fist, a lot of bruising, sometimes some broken bones around the face, and a lot of swelling. But then we typically see the individual that did the punching come in because the hands are fragile as well, so they can fracture pretty easy. Please don't hit each other. Holy cow! Gunshot wounds to the abdomen, they can go all different directions. It's literally a crapshoot if somebody's gonna get majorly injured or it misses different things. I've had patients come in where they're paralyzed, they have a colostomy bag, bullets are still stuck inside of them, all these different things versus somebody who missed everything vital and they're fine. Oh. Oh my gosh. A lot of injuries that come into the emergency department that I see are blunt head traumas, usually from either a car accident or a fall. I've seen everything from a scrape to abrasions, lacerations, to literally death. A fall from standing could be actually deadly. It just depends how much force was behind that fall. Oh! Whoa, 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 whoa. picking somebody up and landing them on their neck in a weird way on a rock. You're having a crush injury related to your neck versus a hyperextension injury. You're stretching the spinal cord in a way that it shouldn't be. Oh, we're parachuting in. So cool.
Primary objective is to eliminate all targets.
Whoa. That was awesome. A lot of lacerations to the back, just causing a lot of discomfort and pain. Lacerations sometimes can be super easy to fix. The issue ends up being is when you get wounds that either an artery has been hit or big vein, and you're just trying to get bleeding under control because you can't see the blood vessel, but you got to stop the bleeding from happening. Sometimes we'll use tourniquets in the emergency department for the short period of time to slow the bleeding down. Oh, wow, wow, wow. So that jump was from a great height. 3 times a person's height is a great fall. We'll see people who come in who jump off of a building or a roof or something, land on their feet, but they fracture their calcaneus. In that circumstance, we're doing x-rays all the way up the body to make sure that the force didn't decide to just explode in one of your vertebrae. And, oh! That much blood spray. The vessels in the neck, the arteries are more dangerous if they get injured. So our bodies are made to have the arteries deeper, that way they're protected. So when you actually look at it, say an ultrasound of somebody's neck, the jugular vein is actually more superficial, closer to the tissue.
Spotted that one.
Sometimes you can have so much trauma to the chest that you can go into cardiac arrest. Or sometimes you can't breathe and you become incapacitated. You potentially would recover from that situation.
Primary objective is to eliminate
Could be a retroperitoneal injury where you're actually hitting the right kidney versus the liver. The knife switched directions and is going to go right to the side of the neck and cause a fatal blow. Oh, a hatchet. So a hatchet right to the upper thoracic spine. The paraspinal muscles are super thick and dense. The skin on your back is even really thick. So it takes a lot of penetration to get deep into the vital areas that you want to get into. Could you go deep enough to injure your spine? Probably not. Oh, sledgehammer to the back of the left knee. If you're actually hitting on an angle there, you really worry about ligamentous injuries. Unlikely fracture, you could, but more in the torque in the sense of the lateral collateral ligament or even just the medial collateral ligament, PCL, the ACL, all these different ligaments that help the structure of our knee. Obviously, this is an intense battle going on in the gulag in this game. The way that they've come up with the graphics and the design of different moves that you can do, impressive. If you guys enjoyed this, definitely check out this playlist right here and make sure that you subscribe, turn the bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.